Good day, everyone. This is Simran Kaur from Voice of Healthcare, and we are back with the third session of our diabetes dialogues. Today, we have a distinguished guest with us, Mr. Jayesh Gadekar, Chief Strategy Officer at JB Boda Group. In today's dialogue, we are not only delving into the critical aspects of diabetes and the challenges that the families could face, but also uncovering the innovative solutions and crucial role of insurance in this narrative. So, we welcome you, sir.
Hi, thank you, Simran. Hello, everyone.
So to begin with, we all know that diabetes is on a rise in India. So, how do you see it impacting the public health and majorly the infrastructure and finances?
Sure, I think firstly, let me congratulate you all for choosing a very important and apt topic. As we all know, unfortunately, India is amongst the top three, four countries in the world in terms of diabetes. And all players in the ecosystem, including individuals, government, and everybody that is there, needs to sort of work towards it. So let me also congratulate you guys for increasing the awareness around this very important topic. From a costing point of view, right? So diabetes, unfortunately, is such an ailment that depending on the type of diabetes you have and the severity of it, you land up spending virtually for the rest of your life, right? And that is something in terms of a cost which sort of gets added to one's monthly financial budget. Unfortunately, from an insurance point of view, unless you have a policy which is sort of supporting it right from the beginning, you might not have much support from the insurance front. There are few insurance companies who sort of work around the diabetes plan, but I think there is only so much that you can depend from an insurance point of view. Therefore, what I do generally is I encourage people to have a much more awareness right from the early detection of this ailment and the right cure for it. So that's my take on that.
Yes, Mr. Jayesh. Like you mentioned that it can be very burdening for families. So, what kind of the financial burden? What kind of burden are we talking about here? Matlab, how it can? If you could just break down the real life impact of diabetes management costs on families.
See, and when we talk about financial burden, it's actually not only on an individual per se, it's on the family, and it's also indirectly on the country, right? From a financial impact, there are, I mean, just to give you an example, and I will sort of break down the cost later, but just to give you an example, the number, so in India, unfortunately, the patient to hospital ratio as it is pretty skewed, right? And it gets more skewed as you go towards the interiors of the country. So that itself is going to put a lot of burden in terms of ailments which arise due to this, and they could be absolutely anything, right? From a diabetic foot to glaucoma to so many things. So the cost per se is extremely difficult to identify because a the cost of keeping your insulin levels and diabetes in control is just one part of it, right? But there are so many other costs which are related to it. For example, like I give you an example, you could have so many other ailments because of this disease, and then it could actually spiral into virtually anything. I mean, we've known people with diabetic foot, for example, who end up losing their feet, or the glycoma, which is an eye related thing. You could land up with losing your vision. So the indirect impact, yeah. So I mean, yes, it's not that okay, I will take a shot of insulin every day and I will be okay. The body is going to break down over a period of time, and it is going to affect other organs, and therefore the cost is something that you really can't estimate per se. I mean, it will be really difficult to estimate, but it could range anywhere from a few thousand of rupees in a year to going up to a few lakh of rupees, right? And like I said, depending on the ailment that you get stuck with.
That's right. So we spoke about the maze of diabetes challenges and the cost that is associated. So how vital is it to have a rock solid insurance in place when it comes to diabetes?
See, if you're looking at insurance, it is something basically in order to put you in the same financial situation that you were before an event occurred, right? Uh, so it is nowhere talking about your health. So let's say if you are in a corporate world, most of these ailments will get covered over a period of time, right? Because you are in the corporate world. But the fact is, you will remain in the corporate world only about 30 to 40 years of your life. And what happens then, right? Um, so, so A is you need to definitely look at how you want to mitigate this risk. And I'm using an insurance term because of the background, but mitigate this potential risk, um, and also plan for it as a family, as a unit. And there are government institutes, government schemes which sort of assist financially or indirectly in terms of getting treatment or medicines at a lower cost. I think the government is also doing a fantastic job of trying to subsidize these medicines, because potentially the cost could disrupt families' financials.
Right. So you spoke about government support and government intervention. So any incentives or measures that they can introduce not only for diabetes management but also diabetes insurance aspect.
And like I said, that's a little tricky thing. The government has introduced, if I may call it, the Modi Care equal to Obama Care program, but that's for the below the poverty line, right? And that policy, depending on which state you are and which state has taken it, will essentially cover everything related to any ailment, including diabetes, under that program. So I said, so from an insurance point of view, yes, the government is trying to do their bit through an insurance program, and the states are doing that as well. Uh, but from an insurance penetration in India, we are still at a very, very low. I mean, the number is rising post COVID, and general awareness of the health insurance is rising. But it becomes difficult to get an insurance policy, especially because you are a diabetic, because the insurance companies on a retail plan might not want to have this kind of a risk. Of course, there are now certain programs with limited terms of coverage, etc., to have this. So yes, there is government scheme, there is insurance programs. From a corporate side, you could build up your own personal insurance programs over a period of time. And like I suggested, that you would need to plan this, as a family, in order to create some kind of fund which sort of takes care of this. So these are a few things that we should definitely look at. But just one more point that I wanted to sort of make around this is an awareness kind of thing. I think that is an area that we all need to focus on. And I think again, from a government initiative point of view, they have started yoga at school. right? I think know your body and know your health and healthy habits is also something I think you could start at as early as the school. And a classic example is what Michelle Obama did. In terms of when as was almost like a pandemic, so as to say, or an epidemic in the US. And what she advocated was you need to have a calorie count in the menus. You need to have the breakdown of the content of the food, and I think this is more to do with awareness. And if we start it young, then my thought is that we would have a better um, leeway in this fight against diabetes.
Right. So you already touched upon the awareness aspect. So, what are the sort of initiatives that you think, from your perspective, that can be taken up in, let's say, schools or colleges to spread awareness about diabetes and related to diabetes education?
So, frankly speaking, I think of course, when I said about schools and colleges, and you talk early, people, young kids are also today talking about climate change, right? So, young kids are talking about climate change. They have projects in their school around climate change. So yes, the effort is there. I think it's also in terms of bringing it to practice, right? So that is something which is important. I think one of the important thing that we also need to do is talk more about it, and I think through mediums like yours, this is some where you have experts coming and talking about it all the time. And unfortunately, because of the cost involved, I have seen that there are also misinterpretation or misinformation, so as to say, which gets spread. And there could be potentially for lack of better words, I would say quacks trying to come in and give some advice and earn an extra buck out of people who are under distress. So yes, awareness, information. Today if you go to the theater, you have to see the non-smoking ad, right? When you're seeing a movie. So the social media, everywhere. If we, as a country and as a nation, take that as an initiative, you will definitely see the change, because we are the largest population in the world today, and if one third of our population is going to be diabetic, then potentially that population is also a risk for the progress of the country, so as to say.
Right. So, concluding the session, I would want to hear your tip or your message for our viewers and all the people watching the session.
So my message is, firstly, read about the subject, understand, be well aware about what causes it, the ailment. There are some modern methods of tracking insulin levels, like you have the CGM, etc. Um, if you are detected with it, don't fret. Talk to the right people, plan for it, look out for the schemes that are already available. And if you are affected, unfortunately, it could be a hereditary thing. So at least you need to be responsible enough to then talk about it within your family and have healthier lifestyles to avoid it.
Thank you so much, and a big thank you for shedding light on the importance of diabetes management and insurance when it comes to diabetes. It's been an insightful session, and awareness is the first step that is important for a healthier future. Stay tuned for more engaging conversations like these. Thank you so much. Thank
Sure.
you.